Nikhita currently works as a medical assistant in a pediatric clinic while applying to medical schools with the Ladybug House. She's very passionate about advocating for various fields of medicine, including women's health, on top of pediatric care. Fun fact, she loves to dance and has been doing so since the age of 4. So with no further ado, understanding the needs of pediatric caregivers in Washington, USA.
Awesome. Hi everyone, my name is Nikhita. Thank you so much for that introduction. As it was just said, I just recently graduated from university, and today I'm going to be presenting a retrospective survey on the caregivers of pediatric palliative care, caregivers in the state of Washington in the United States. But before I get into the data, I want to share why I personally got interested in doing research in palliative care. And honestly, it was this schedule right here. And it's a schedule of a mom, a single mother, and her day starts at 5 a.m. and it just continues on, and she has to make sure that her child takes her medication, make sure the child goes to therapy, but also make sure that her other child goes to classes and takes care of, extracurricular activities, but also pencil in time to brush her teeth and take a shower. And for me, that was really shocking because I grew up in a very community-focused environment. I spent some time living in India, where I would see not only the parents take care of healthy children, I would see grandparents, cousins, neighbors, friends, everyone take care of a child. And it's a very a village raises a child. And so I wanted to see how we could best support these caregivers, especially since so many of them are not getting much outside help. So before I delve into the data, some background about the palliative care landscape in the United States. If we look at the state, I don't have a pointer, but if we look at the state of Washington, over there in the corner, no home-based hospice or home-based palliative care. The darker blue signifies that they have both in those counties, and the light blue represents only home-based hospice, and light green is only home-based palliative care. And so if we see the state of Washington in that corner, we see majority of the state does not have any home-based pediatric home services. And that leads to less than 30% of pediatric patients in the United States to have access to hospice. And this, I know in the corner it says that it was it's created in February of 2013. However, this data was also published in the 2023 Facts and Figures journal. So the data, unfortunately, have not, we see that there's not been much change in the last 10 years, unfortunately. So what we decided to do, and just looking at other countries in the United States, there are only 3 pediatric palliative care homes in the nation, and we're hoping to increase that number. So what we did is we did a retrospective survey, and we we surveyed about 300 participants, and we used a Qualtrics platform in conjunction with the Seattle University's College of Nursing. And so we surveyed 300 participants, asked them over 150 questions, and some of the major takeaways that we have, I'm going to go over them slowly. But if we look at these 2 heat maps, I'm going to start off with this one first. We're looking at the amount of time these caregivers are putting in and how many, and their income level at the time of providing care for their child. And we see the majority of the graph is colored blue to the left of the $100,000 per year. And so that means these families are making less than are usually making less than $100,000 per year. And if you look at the cost of living of the state of Washington, it approximately is $102,000 to live in the state of Washington. And knowing, as many of you may know, the United States does not have free health care. And so these parents, these young parents, are putting in a lot of time and effort, but also they're not able to afford providing medical care just because of how expensive it is. And instead they have to spend more time caring for their child, and they can't make, they can't afford other aspects. of their lives. And then if you look on the other side, the education levels and working during care kind of goes in conjunction. You see majority of our caregivers are not working during care, and because they're spending time with their child. So again, we see these disparities that these caregivers go through because of the lack of resources that they have. So going over some takeaways from the rest of the survey, the number one thing that we found was that only 8.9% of caregivers found it not challenging to find a caregiver for their child's needs, which means over 90% found it anywhere between challenging to very extremely challenging to find a caregiver. And little information about the state of Washington is that there is the top 10 children's hospital in the nation, and so even with all these trained individuals in the area, they're still struggling to find caregivers here. The next thing is that only 13% of caregivers felt that they were able to get enough sleep for most days. And as we know how important sleep is for us, it affects their health, affects how they're able to show up for their children. So that was a big thing that I saw over and over throughout the data. The next thing is that the average caregiver dropped about 0.69 income brackets while caring for their child, and that could be due to not working because they're caring for their child. There was also a really high rate of divorce during while caring for their child, and that leads to income levels dropping in the family. And then we also found that 48% of caregivers reported facing negative medical health issues for themselves. A lot of our caregivers reported having type 2 diabetes, weight gain, thyroid issues, heart disease, but also many reported struggling with anxiety during and after care, PTSD, depression, and many other mental health issues. The next is that 39% of caregivers reported struggling to find caregivers due to the lack of trained individuals. And as I was saying earlier, Washington has a plethora of hospitals in the area and still struggling to find caregivers. Makes it even probably worse for other parts of the nation. And then finally, we found that 91% of caregivers would consider non-life-threatening medical care needs at a facility other than a hospital. And so from this, we kind of, we figured that the best thing to help support our caregivers was to have a respite home, a place where they could come in and bring their children, and it's a place of rest, and a trained medical professional would help out with their child, and they would also get the rest that they need to better support their children and the rest of their family and themselves. So I want to say thank you so much to all of the caregivers that supported us during their difficult time and filled out a very lengthy survey. I'm unsure if we're having technical difficulties on that QR code, so I brought my computer up here, and if anyone would like to scan a different QR code, I have it ready in case that one doesn't work. One of the two will work. But thank you so much for listening to me today.
Thank you, Nikhita. Any questions for Nikhita? I have a question. Do you have volunteers in the area that would be willing, under some sort of association, that would be willing to ease some of the suffering of parents, to take some time off, or not?
Yeah, definitely. So the foundation that I work with is called Ladybug House, and it's a team of volunteers that are looking to support the caregivers in the area by building a respite home. So that is how we feel we would best support our community.
Okay. Renee.
Thanks, Nikhita. That was a lovely talk. And well done, good luck getting into medical school. But I was wondering, how is Ladybug House going to be funded?
So So I will say this is not my area of expertise. I will more work on the research side, but I believe we're working towards getting investor funding, government funding, and a pool of other resources. If you would like more information, this QR code will hopefully work better. But yeah, that's not my personal expertise, but yeah, I think we should have more information on our website. Thank you.
We might have a longer conversation over lunch because it's striking how different countries palliative has developed differently, right? So in the UK, right, I mean, you started when in the 80s there, and then it's 1950 plus hospice houses, which would be American language, when in the United States only 3. We are lucky to have one in the area of San Francisco, the George Mark House. And where most children's hospitals have like strong palliative care programs inside the children's hospital and then sort of reach out to the home care service, there are just very few places. And financing insurance is a big thing. And like running a house in the US, it's about $8 to $16 million US per year, which is far more than sort of many other places due to requirements, how many nurses you need and so like that. So it's sad, right? And this respite houses, this hospice house really is something we're missing as a third option.
A very quick question. So these volunteers are delivering respite to.
So at the moment, we do not have a respite home yet. We are in the process of
At the home. At their home.
Yeah, so we would have trained medical members come in and provide quality care for the children who would come in. But it would be volunteers. I'm a volunteer and I help with the research aspect. And like volunteers, we do some bereavement camps to help with the caregivers and the siblings, and those are led by volunteers and other trained professionals. So there's space for yeah.
You mentioned that even with the availability of hospitals in the state of Washington, approximately 9% of the families found it difficult to find caregivers. I'm just curious, do you know the percentage of trained compared to non-trained caregivers for the families in Washington?
So I will say this, I don't know the percentage of trained versus non-trained. However, a lot of the feedback that we got from the caregivers is that even if that there was a caregiver that would work for their family, a lot of times they weren't trained in the specific tasks that they needed to. And a lot of these complex kids, they don't just have like one issue, they have multiple issues. And it's hard to find a caregiver that matches all of their needs. And it could be, that was the main reason. There was also difficulty in like times of like, like the accessibility of these caregivers. They, like the schedules, a lot of times schedules won't match up. There's difficulty in trusting the caregiver, especially when there's a high turnover in these positions. So it's due to those reasons we found that, those major reasons, we found that a lot of caregivers reported difficulty in finding one.
Dr. McCullough, one more.
Nikhita, just an idea for research which would be pretty groundbreaking. Perhaps if there was an opportunity to look at the cost of the build of the hospice, the operational running of the hospice, or Ladybug House, actually cost per patient per day. One wonders about putting that into the community rather than into a building. Slightly controversial, but something to really think about. How many children are there? What could be offered at home? Whereas, what could be accessed to families for respite?
Thank you. Yeah, I think that's something that would be really interesting to see where the best benefit would come from.
John Wolfe, I think, wrote an essay, an editorial a few years ago, sort of on the same line, where basically saying, like, how do we get the most bang for our buck? So if we spend $1 million, how do we get? And most children are at home most of the time, and this is where they need the help. And Often it's very sexy to have those